If you have spinal stenosis and you're waking up with pain in the morning, there's a good chance that your nerves are getting compressed during the night when you're asleep. In this straight to the point video, I'm going to show you some minor adjustments you can make to your sleeping positions that can make a big difference in how you feel the next morning and the rest of the day. One of the biggest challenges with spinal stenosis is compression of the nerves that can cause pain in your back and pain going down your legs. The key to managing spinal stenosis is learning what positions cause compression on those nerves and then avoiding those positions so that you can get blood flow to your nerves can breathe, and your legs and your back feel much better. So, this is often addressed with movement, but it's often missed with sleeping positions. If you're sleeping in a position that is causing compression on your nerves, the longer those nerves are being compressed, the longer it takes them to recover once that compression is removed. So if you're sleeping in a position for 4 or 5 hours where those nerves are getting compressed, you can imagine that's going to mess you up in the morning. That's going to mess you up the next day because you don't just relieve the compression and boom, it's fixed. It takes time for that blood flow to be restored. It takes time for those nerves to regenerate. So pay attention to these positions I'm going to show you and these adjustments you can make so that your nerves can breathe throughout the night. If you're serious about reducing your low back pain and restoring your mobility, check out my free mini course in the notes below. It teaches you 4 foundational techniques you can start using right away. If you have spinal stenosis and you sleep on your back, try putting a thick pillow under your knees throughout the night, okay? When you sleep on your back and your legs are straight without a pillow under your knees, oftentimes your low back will arch off the bed, even slightly, and that arch is extension of your lumbar spine. That extension of your lumbar spine typically causes compression with spinal stenosis, and that can cause symptoms down the legs. So if you put a pillow under your knees, it actually allows your back to flatten a little bit. It gets rid of that arch. It allows those nerves to breathe throughout the night. So give it a try. You could actually use a fairly large pillow. You could actually use 2 pillows, but you should feel a difference the next morning if you sleep on your back and you're waking up with pain. Give that one a try. If you have spinal stenosis and you're a stomach sleeper, sleeping on your stomach often causes that arch in your low back. That arch in your low back causes compression of the nerves. That's typical of spinal stenosis, and that can lead to symptoms down the legs, and that can lead to a rough morning and a rough day the next day. So, if you're a stomach sleeper, try putting a pillow under your hips, the lower part of your stomach, the upper part of your hips. Okay. What that does is it allows your back to flatten out a little bit. It takes that arch out of your low back. It opens those spaces that the nerves travel through, and it allows those nerves to breathe throughout the night. Okay. So don't be afraid to use a thick pillow. You can even use 2 pillows. Don't place the pillow too high. Place it below your belly button, more so under your hips. Give that a try. It can make your next day much better. Real quick, if this video is helping you at all, please give me a thumbs up. It helps me know which kind of content is more helpful to you so I can make more. If you have spinal stenosis and you're a side sleeper, you can often get compression of the nerves on one side of the spine if there is a small arch in the spine going down towards the bed. So, if you're getting compression on those nerves, you might get symptoms down your legs. You might even get symptoms down one leg. And what you can do to avoid that is put a pillow between your knees. Okay. That pillow between your knees is going to help level your pelvis. It's going to help keep your spine in a more neutral position and hopefully open up the spaces that those nerves travel through so that those nerves can breathe throughout the night. An additional change you can make, you could try a pillow between your ribs and your hips on the side that you're sleeping on. Probably not a very thick pillow, a thin pillow, but if you do that, that's going to even further help keep your spine in a neutral position. It'll keep those spaces open for the nerves to travel through. It will allow those nerves to breathe throughout the night. It should make your next day much better.